Hello there and welcome to a very special show here on CNN IBN on Women's Day. We're discussing the most common cancer to affect Indian women, cervical cancer. And to do that, we have a very distinguished panel of doctors with us. We have Dr. Neeja Bhatla with us. Welcome to the show. You're, of course, Additional Professor, Department of Obstetrics and Gynecology at AIIMS. And Dr. Bhatla has extensive experience in gynae oncology with a special focus on cervical cancer prevention. We also have with us Dr. Hema Divakar, Consultant Ob-Gyn at Divakar's Specialty Hospital. She's also the Senior Vice President of the Federation of Obstetrics and Gynecology Societies of India. We also have Dr. Shyam Kukreja, the Head of the Department of Pediatrics at Max Balaji Hospital, and also an expert on immunization and vaccines. Thanks for being on the show. And finally, we have Dr. Shailesh Mehta, the Medical Director of GSK Biologicals. So thank you very much, all of you, for joining us on the show. But let's get straight to it then. To find out more about what cervical cancer is, let's take a look at the story.
Jade Goody is no more an unknown name in Indian households. On yet another episode of her claim to fame, Big Boss, she made a shocking revelation which changed her life forever. She was suffering from cervical cancer.
Since last day May, I'm practically bald now. I look like a chick, like one of those little newborn chicks.
Sharing the tears with Jade, the entire country came to know about the lethal ailment which was missing from the diaries. According to a 2007 WHO report, 75,000 Indian women die every year due to cervical cancer, caused mainly due to human papillovirus. It's a cancer of the mouth, of the uterus, the cervix. The cancer primarily affects women aged between 18 and 45 years. But the country is still oblivious to this ailment.
There are about 132,000 new cases every year and 72,000 deaths. Well, like most cancers, it could be asymptomatic. In advanced stages, women could present with some irregular bleeding, intermenstrual bleeding, bleeding after intercourse, what we call postcoital bleeding.
Cervical cancer is treatable if diagnosed at an early stage. However, the experts believe that if something isn't done soon, the death toll will continue to rise.
That death toll is certainly a cause for concern. We understand that nearly 75,000 Indian women die of cervical cancer every year. It's an alarming statistic.
Yes, that's right. It's the most common cause of death from cancer among women in India, and it's the #2 cause worldwide.
All right, so let's talk a little bit about the leading causes of this. There's the persistent infection by a group of viruses called the human papillomaviruses, or HPV. Could you tell us a little bit about that?
See, HPV viruses are something like 100 types of viruses, and out of this, something like 15 are those who cause cancer. And these cancer can be in the cervix, it could be in the anal area, it could be in the vaginal area, it could be sometimes papilloma in the respiratory tracts. So these are the type of infections these HPV viruses cause. The other viruses, the rest of them are not so oncogenic, means they do not cause cancer, but they may cause illnesses like some simple infections which are not very dangerous.
Infections in genital warts
Yes,
and such. But doctor, if I could ask you as well, are these the only cause or are these the major cause of cervical cancer?
Yeah, the HPV presence is a necessary cause for having cervical cancer.
All right.
There are other risk factors like smoking, immunosuppression. These may contribute, but having HPV is a must. That's why we call it necessary cause.
Are there any symptoms that women should be watching out for?
See, early stages of cancer are typically asymptomatic. That means they're silent and the women doesn't experience any problem. But our antennas go up and we are on the alert when a woman who has attained her menopause, 48, 50 years, and then 5 years down the line, she starts bleeding again suddenly. Oh, then, there is likely that it can be out of cervical cancer. Similarly, after an intercourse, if you have a bleeding, that again raises a suspicion. And in between the menstrual cycles, a bizarre kind of bleeding pattern. We always, depending on the age factor also, we need to rule out the cancers.
Should we get a question in at this point? One of our viewers has called into our channel. Her name is Dimple. Let's listen into that.
I am 22 and I have a question like, what is the risk of people of my age getting a cervical cancer?
Although we say that the average age is about 50 years in our country, but that is because women are not coming in early enough for one, and that is because it takes time to grow. So this is the age. She's at the age when she's at risk of getting the infection now. That is maximum at this age group. And the consequences will take 10 to 20 years to show up.
The most important point here is that it is driven out of a sexual activity. So women who embarks on a sexual intercourse at whatever age, from then onwards, she is like to be labeled at risk.
Wait, just to make sense of those then, so you're saying every woman is at risk in their lifetime?
So,
is what you're saying.
So about 5 to 7% new infections every year, generally in populations, and about 80% of women will get this infection at some point in their lives.
80% of women, that's a huge number.
That's
Yes,
a huge
absolutely.
number.
So almost everyone is going to get it.
All right, so your basically advice would be that by and large everyone should be aware of this and be go for screening in terms
Absolutely.
of All right, let's get another question in at this point from another viewer.
Hi, my name is Jyotsna and I have a question about cervical cancer. If someone has a family history of cervical cancer, is there a higher probability they will get it later on in their life? Or how often should they get tested?
No, this particular cancer does not have a genetic or a hereditary background. It's an infection driven. Anybody who gets an HPV infection whose immune system does not tackle it, after a couple of years may be prone to develop a cervical cancer, which means therefore that every woman needs the same kind of attention with respect to cancer cervix.
Okay, so I'm going to come back to that 80% of women are going to get this infection at some point, and we see that 75,000, that's the number we're hearing, 75,000 Indian women die a year of this. What do you see in your experience when they're coming in? You're seeing obviously younger children as well.
The way it would hit the head is 4 women anywhere in the world dying of cervical cancer, 1 of them is an Indian. So that is an alarming number.
Any factors for that number being so high here?
The reason why the West is number 2 and worldwide, and for us it's number 1, is mainly because we don't have the awareness. We don't have, even in women who are aware and affording, the infrastructure may be lacking. There may be other reasons why we have never been able to implement a national cervical cancer control program, which in the West typically is mediated by pap smears, which have to be regularly done on anything from every year to a once in 3 year kind of basis.
All right, so we're going to continue this discussion after a short break and discuss more about the pap smear test and also what you need to know to protect yourself. So stay with us. Welcome back to this special show on cervical cancer. As we've been saying, that affects 75,000 Indian women, killing them every year. We all know that British reality TV star Jade Goody is dying of cervical cancer. Her diagnosis came in simply too late. So that brings us to a crucial question from one of our viewers.
Hi, my name is Priya. I want to know, how does one detect cervical cancer before it occurs?
All right, doctor, you've been talking about this a little bit. The pap smear test, is that the most efficient way?
Yes. The strength of the pap smear has rested on the fact that in the West, they call them back every 2 to 3 years to repeat it. And because the natural history of the disease is such that it takes about 10 to 20 years for the final changes, so you can intercept at some point when it is still not in cancer or it's an early cancer. And to that extent, PAP has been a very successful method in the West. We could never implement in India, partly because we don't have that kind of infrastructure. So they have looked at other tests for India and developing countries now, which is called VIA and VILI, which are visual inspection tests, which any doctor can do. It just involves simple application of acetic acid, which is like vinegar, or iodine, to see the color changes on the cervix and be able to detect as many cases as the PAP would. But then they need further management in case they are positive. And you do have now, since we know that HPV is the cause, so we do have also HPV tests that are available. And the good news is that those are very sensitive.
All right, at this point, our viewer Prerna is calling in. She has a question on the pap smear.
Hi, I'm Prerna. I wanted to know, how often should one undergo the pap smear test? Should it be more than one time? I'm over 30.
All right, she's over 30.
At least every 3 years, we'll be able to detect about 92% of lesions. The rest of the lesions do get missed, either because they just errors in sampling, or because they are located inside the cervix, like the adenocarcinomas, which are never reached by the screening techniques.
I think it's a good idea whenever you're visiting the obstetrician or the gynecologist, do get a pap smear, and you visit maybe every year or every 2 years. It's a very good idea to get a pap smear done.
Okay, at this point, we'd like to throw the questions open to the audience as well. Does anyone have any questions for our doctors on the issue?
If the lesions are not covered 100%, why shouldn't we go for a pap smear test done every year, instead being advised after 3 or 5 years?
Yeah, if you see a reproductive age group and you see that over 30 years you want to do the tests typically. So if you're doing it every year, it will be 30 tests. But if you're doing it once in 3 years, it will be 10 tests, and the incremental difference is about 1.5 to 2%. So it has to be weighed in that terms.
What are the symptoms of cervical cancer after a female attains menopause?
At menopause, a woman thinks that she's over with her reproductive jobs, and then most women never bother to come and visit a gynecologist. If she stopped menstruating at around the age of 50 years, for example, 2 years, 5 years, 6 years down the line, she's 58, and then she comes back with a scanty bleed or an enormous bout of bleeding, that really draws our attention. There could be a foul smelling vaginal discharge, which also, provokes her to visit the doctor because it draws her attention. Also, there can be a wide spectrum.
All right, so we're going to take another short break at this point, but still ahead on the show, there are new vaccines available for the prevention of cervical cancer. We'll get to more on the questions and the controversies when we come back. Welcome back to this special show where we're discussing cervical cancer. Let's talk a little bit about these new vaccines that are now on the Indian market, available to Indians as well, to prevent cervical cancer. Could you tell us a little bit about them?
HPV infection can affect women at all ages, and there are about 5 to 7% new infections occurring through life. And it's a very interesting fact that the natural infection does not create an immunity, so there is reinfection possible even with the same type once infection clears. Therefore, this is a situation where the vaccine is expected to benefit all women at all ages.
This is a welcome addition to the list of vaccines for the adolescents. Like we have diphtheria, pertussis and tetanus vaccines, and the list is now added with the HPV vaccine, that's the cervical cancer vaccine. So every age group where the chances of getting that particular disease is there, we have a vaccine to prevent it.
All right, at this point, let's actually hear from a leading doctor, AJ Chitkara, actually, on the research, the path-breaking research that led to the developments of these vaccines against cervical cancer.
You always have to have research in that direction, that what particular component of the organism is going to be protective in the human being. So, identifying that particular antigen, which we say, seeing whether it really protects on a long-term basis or not. It is not that you can keep on giving yearly vaccines. You should be happy with a vaccine which given once, maybe 2 or 3 doses dispersed over a period of time and giving on to long-term protection.
All right, so if I could ask you now at this point, who do you think in your opinion should be getting vaccinated?
What we've been talking about so far is secondary prevention. So here now we're talking about primary prevention. So primary prevention is actually for everyone.
But there are age limits?
Ideal scenario would be that when the HPV has not yet entered the girl's or the women's body, by that time you give something preventionary. So the ideal group will be 10, 12, 14, 16, maybe before the girl embarks on a sexual activity. And that's why the Pediatricians Association have already put it on their list as one of the vaccines at age 10, 12. But it's for us as gynecologists or obstetricians to tell the women when she gives birth to a child, a girl child especially, to tell her that in the whole series of vaccines against measles, mumps, rubella, whatever you have it done, one of the last that the option that is available to your child when she is about 10 or 12 years of age.
How long does a vaccine protect whoever's been giving to? How long does it last in that sense?
It has been shown that women up till the age of 45 will be able to get as good an immune response. They can actually take it even at a later age, even after they're sexually active, because they could be still protected against the other type.
All right, that brings us to a question that Shweta has actually called in to ask. Let's listen in.
Hi doctor, I'm Shweta from Chennai. Is vaccination enough, or one also needs to go for screening and all to prevent cervical cancer?
It's complementary, it's not a replacement for one against the other, because the vaccines, as how it's been repeatedly said, out of hundreds of varieties of HPV viruses, there are 2 or 4 which are taken care of by vaccinating the women, but there are several other types which could also lead to the same end point. So the screening programs have to be well in place, but adding on a vaccination program as well as a primary method of prevention.
But let's talk a little bit then about methods of treatment. We understand there's no cure for cervical cancer.
If the prevention is not in place, and by the time the disease is silent and they come to us, it's an advanced stage of cancer. So it would involve typically what a cancer treatment would involve, because the philosophy of cancer cells, as you know, growth for the sake of growth. That's it. So depending on how advanced it is, the surgery, the chemotherapy, the radiotherapy, then we need specialists like Nirja, the gynec onco people there in place, and the costs involved and the morbidity and the deaths. So it's all a serious package.
So it depends on what stage the cancer is detected. Yes. So if we were talking earlier about detecting it early on, what would you then tell a patient who's come to you and say not a stage 3 like some of your more advanced patients?
Early stage ones, well, they have an option of either a radical surgery or radiotherapy. And as we go later into the disease, then surgery becomes impossible. And from stage 2 onwards, it's just radiation therapy that is available.
Okay, let's bring in Dr. Hemant Tungaonkar here. The question for you is, how many women are affected by cervical cancer?
I think cervical cancer is a huge problem in our country. It is the commonest cancer among women in India, with nearly 130,000 women being newly diagnosed with this cancer every year. And we contribute nearly 1/4 to the total global burden of cervical cancer.
Also to ask you, what are the treatment options once people know they have cervical cancer?
Now we have these vaccination strategies that are available all over the world and also in our country, and vaccination against oncogenic HPV subtypes is, in my opinion, a very important step in preventing this cancer or controlling this cancer worldwide.
All right, thank you very much, Dr. Tungaonkar, for joining us on the show. All right, that brings us towards the end of our show. I'd like to invite you all to make a closing statement. You were saying, interestingly, that it's something that's preventive, but
preventable, but not prevented, but certainly a lot of hope on the horizon now with new methods of testing, with vaccines for primary prevention. We do hope we'll see the last of it.
All right, and you're hoping to see more people come in for screening as well?
Yes. So awareness is my trump, because someday, some hope, at least they should know about it.
The carry home message should be, the vaccine is available to prevent against the cancer. It prevents against something like 75% of the cervical